Welcome back to 2 News Sunrise. And joining us now is Dr. Susan Love, a woman very familiar with the active research on breast cancer prevention. And she is here for a special event. We are a sponsor of the Ribbon of Hope luncheon today. And we are so glad to have you with us, Dr. Love.
Well, thank you. It's great to be here.
And Dan, of course. And, let's talk a little about how far we've come in terms of breast cancer awareness and prevention, because you are considered a founding mother, if you will.
Yeah, unfortunately, I guess, but we really come pretty far in terms of treatment. We've got a lot of better treatments, a lot more people are living longer, but we haven't done as much in terms of prevention and figuring out the cause of breast cancer. And I think it's about time that we move a little bit of the spotlight to, let's just figure out what causes this and see if we can't stop it altogether.
What advice do you give women?
Well, right now, the things that we do know are exercise will both prevent breast cancer and prevent a recurrence of breast cancer. So that's worth doing. Trying not to gain too much weight postmenopausally, important. Stay away from radiation. If you have a choice, have your kids when you're young. Older you have your kids, a higher risk of breast cancer. So there are some lifestyle things you can do, but none of them are 100%. And then obviously, if you have anything or feel a lump, you should get it checked out. Once you're old enough, you should be getting regular mammograms.
Do you think we're making inroads?
I think we're making inroads in treatment. But when treatment is surgery, radiation, chemo, hormones, targeted drugs, that's a lot. And all of them have side effects. And so rather than having so much on this end, I'd really like to see us just stop it. We have a vaccine for cancer of the cervix now. We could do that for cancer in the breast if we just do the research and figure it out.
Well, in terms of prevention, you talked about mammography. And there are opportunities throughout our community to get free mammograms, and yet there are a lot of women who still don't do it. How do we get through that? Is it the fear, you think, Dr. Love, that keeps folks from doing that?
I think it is the fear. I think people are, somehow if I don't look, I won't find it. And of course, that's never the case. So every woman over 50 should be getting regular mammograms, and women under 50, from 40 to 50, who are at increased risk, should also be getting mammograms. At the moment, it's not prevention, it's really finding cancers that are already there, but it's the best tool we have.
And breast cancer among men as well. People don't talk about that. They feel a little uncomfortable with that, perhaps.
That's right.
But we're seeing that.
We're seeing that, and anyone who feels a lump, male or female, should get it checked out. And if the doctor poo-poos you and doesn't pay attention to you and you think it's wrong, you go to another doctor.
Another doctor.
That's right.
Dr. Love, thank you. It's a real privilege to have you on the show.
It's great to be here.
See you on the Today Show all the time. So.
All right. And we've got, of course, the event coming up this afternoon. Just looking forward to that. Hosted by the Kettering Medical Center Foundation at the Ponit Center. And there's the number on your screen for more information, 395-8324.
All right, time now.